It's a pleasure to welcome Congressman Dr. Phil Roe. How are you, sir?
Andy, I'm doing great. Thanks for having me on this evening.
Absolutely. A true pleasure. Now, Dr. Roe, you were quoted in an article yesterday. It got my attention because you being a doctor and a congressman, that you say Obamacare has been tried, a similar program in Tennessee, and this program collapsed in Tennessee, and you're predicting the obituary for Obamacare. Just financially, this can't work. Take the floor. Tell us what you know.
Well, Andy, here's the problem in American medicine today, and every doctor that's been out there practicing knows. Number one, it's too expensive. The costs keep going up and up and up. And two, we had a segment of our population that needed coverage and couldn't afford it. Thirdly, we have a liability crisis. Well, those same things we looked at 20 years ago in Tennessee. So very rapidly, without anybody's input, a plan called TennCare was implemented, which was going to be a managed care plan where people competed. Remember the exchanges that are going to be set up?
Mm-hmm.
There's going to be all this competition. We're going to compete for your business, and that way we're going to force costs down. What happened in Tennessee? What happened was that in 10 short years, and that's about what this plan, this Obamacare, will do. In 10 years, our costs for health care among Tennesseans in the TennCare program had tripled from $2.5 billion to $8.5 billion. It took up a third of the state budget.
Mm-hmm.
We had not put another new dollar into higher education, anything else the state did, because we didn't have the money. So what happened? Who signed up? Well, this is what was really amusing. So half the people who signed up for TennCare had private health insurance and dropped it.
Huh.
Well, what exactly do you think is going to happen here with employers? And let me just tell you, this week I was at an event, a small event at someone's home, a little town hall type event, this Tuesday night. A guy came up to me who's a manufacturer, and he said, Doc, I got 56 employees. I had 56 employees, past tense. I now have 48. Well, why would the man do that? Well, the reason he did that, he didn't want to have less employees because he had less business. He had an added cost coming to him called Obamacare. And if he gets under 50, his business doesn't hit all those benchmarks. So therefore, he made that decision.
Mm-hmm.
Another person came up to me, not this Tuesday night, but previously, who has 10,000 employees, a lot of employees. And this guy is in the grocery business. And so what did he say? He said, I've got people who work 32 or 3 hours a week. I've got a 1 to 1.5, and a big margin in that business is 2%. He said, I'm going to, instead of working 32 or 3 hours a week, they're going to work 27 or 8 hours a week. And I'm going to get them below the 30-hour full-time. And business people are going to do that to survive. And what will happen in this, and I can write, as you pointed out, Andy, I can write the obituary and have about what is going to happen with this. I'm the chairman of the Health, Employment, Labor, and Pension Subcommittee here on the House side. And we held several hearings outside of Washington, one in Butler, Pennsylvania, one in Evansville, Indiana.
Mm-hmm.
Just regular folks, business people came up and told us about this. It will not work in the restaurant industry, in the entertainment industry. Those are industries that cannot, right now, don't have the money. They can barely stay afloat now. This is going to be an added cost to them. And I can tell you, I spoke to our governor last week. We've seen this before. When you increase massively Medicaid, there's going to be an added cost to the states. Now, look, there's a good thing that happens here, and that good thing is more people get covered. There was just a better way to do it.
Right. Now, Congressman, the key thing for most of the people listening to the program, we're going to talk about, 80% of Americans who fall, they're not the wealthiest, but they're not the poorest. So 80% of Americans who are happy with their health coverage. Obama sold all of America on the idea that if you like your insurance, you can keep your insurance under Obamacare. I'm going to play a 10-second clip of him saying that. This is how he sold this to the American public. And I'd like your response, because if I'm wrong, I want to hear about why, because I just don't see this ever happening where people are going to be able to keep their insurance. I think they're going to get dumped on the state exchanges. Let's listen to Obama.
If you're one of the more than 250 million Americans who already have health insurance, you will keep your health insurance.
Congressman, it was sold on that very principle. Is that true? Is what he said true?
Well, let me put it this way. If you've got a company that is having an added cost, a business, and I ran a business, we have a medical practice, Andy, that started with 4 doctors and 12 employees. When I came to Congress 4 years ago, I just checked with our group the other day that I still am very close with. We have 100 providers and 450 employees now. If we drop our employees off into the exchange, it'll cost us $2,000 to do that for every employee over 30. But we're paying about $6,000 or $7,000 per employee now. You do the math. You multiply 400. That's about how many people get insurance in my office. Times 5,000, you get $2 million. I can put to the bottom line tomorrow in my practice. Now, do I want to do that? No, because I think you get good employees by offering these benefits. That's what we've believed that for 40 years in our group. But the thing is, the CFO and the HR director are going to have this discussion. And when you're competing in a world market, it's like a guy told me in front of one of our subcommittee hearings, and I'll never forget these. He said, Doc, I'm not going to be the first one to drop my health insurance coverage for my employees, but I'm not going to be third either.
Right.
Meaning that if once a domino, once a shoe drops, then others are going to do it to save money, because if you see cash going down, your business going down, you're going to look for ways to cut costs. And that's one of the ways to do it. I think right now that the federal government has grossly, just watching what happened in Tennessee, where half the people that got on the new plan dropped private health insurance and got on the plan that the government had. That's what you're going to see here, except it's going to be just the opposite. In Tennessee, we created such a rich plan to be on. It made sense to get on it because it cost less, it provided more till we found out we couldn't afford it. And let me tell you what happened in Tennessee. Let's continue that scenario.
Sure.
The middle class we're talking about.
Yep.
A Democratic governor, who I like, Phil Bredesen, cut drastically the rolls of TennCare because the state could not afford it. So you ration care by just cutting people off the rolls. What will happen with this one is that if you don't pay the cost of the care, and that's a little secret out there that nobody understands, is that Medicaid doesn't pay the actual cost of providing the care, and those costs are shifted onto the private sector. So in Tennessee, it's about 60%. And if you do that, once you shift those costs, sooner or later there's an end point to there where the private sector says, no, we're not going to do that anymore. Well, what happens when you don't pay the doctors like your dad is? What happens? They can't afford to see those patients, and therefore you create waits and you ration care that way.
Now, Doctor, I want to, and once again, people just joining us, we're talking to Dr. Phil Roe, also Congressman Phil Roe. It's nice, by the way, Doctor, to speak to a congressman who actually has a skill outside of, being a public servant. I think that's a nice thing. So I think our founding fathers envisioned the idea of public service being exactly that, where you have a trade or a craft or a skill, you do that, and then later in life, you serve the public with that knowledge that you can bring to the public sector. That's what you did with your life, and it's just amazing that you have people like Obama, Bill Clinton. They make a career out of being in public office. It's almost like a sad thing. But, Doctor, I want to next talk about what Obama sees as the panacea, a major cost savings when it comes to Obamacare. He says electronic medical records. If all these practices are switching to electronic medical records, then we're going to have billions of dollars in savings. Care is going to improve. All the doctors that I speak to say that electronic medical records, they're cumbersome, it's complicated, it makes things less productive, and it costs a fortune. The government is spending, and people don't know this, billions of dollars the government is spending, billions of dollars to shift towards electronic medical records. What's your honest feeling about that? Go ahead.
Well, Andy, I've got a little bit. We actually, in our practice, 5 years ago, initiated the electronic medical record, and we are doing it to stay in compliance and keep up with all the requirements that the federal government. That this really does not add to. It's everything I look at, Andy. When we pass a law up here, when we pass a healthcare law, does it make it easier and less expensive for my patient to come and see me, and does the quality of her care go up? If the answer to that's no, I'm going to be against it. And this bill right here, this electronic medical record, sounds like a great idea, and maybe someday it will be. But 5 years ago we did this, and I laughingly told you off air that it was probably the reason I'm a congressman now. It was so cumbersome to utilize this thing, and it does have some advantages. One is are the e-prescribe, or prescriptions that you can send to the. No longer does the pharmacist have to look at my terrible handwriting and decide, can I decipher what is here? So there are some things there that you can use it for. But it does slow the doctor down. And one of the things I would never do is I wouldn't even take the thing in the examining room with me, because the patients would complain, all the doctor does is looking at this computer. He's not paying any attention to me at all, and there was some validity to that. So maybe the younger doctors will be more, with their iPads and so forth, will be more familiar with it. I don't see the savings right now, and I've talked to, matter of fact, it was one of the things I met with these doctors Tuesday night. They were complaining about that very thing, that it's a false narrative out there that it's going to save billions of dollars. It's not. I remember the night I was sitting there at 8 o'clock at night, entering data into a computer, thinking, if I'm sitting here at 8 o'clock at night, I should be seeing patients and taking care of them, not putting data into a computer.
Absolutely. Now, Congressman, this is my final question for you. And people just joining us once again, Congressman and Dr. Phil Roe from the 1st District of Tennessee. So earlier you talked about the obituary of Obamacare, that financially, this has been tried before. It fails every time. It was tried in Tennessee. It financially collapsed under its own weight. So Obamacare will have a shelf life of, let's say, 10 years. What will happen between 2014 and, let's say, 2024 before it collapses? Because what I see from everything I read, and I'm not a doctor, so tell me if I'm wrong here, the super wealthy will be fine because they're going to switch to all cash doctors. A lot of doctors will say, hey, electronic medical records, Obamacare, the nightmare that's insurance. I've had enough. I'm older in my practice. I'm just going to deal with wealthier patients that can pay me a monthly fee or a yearly fee, or that can pay in cash. So the best doctors will treat the wealthiest 5% that can pay cash. Then you've got the bottom 10% who didn't have health insurance. They're benefiting because they're getting something, it's a free gift, something they didn't have before. So they're all going to swell into the system. 30 million Americans are going to swell into the system. So for the top 5%, they're better off. They get to see a doctor faster with cash. The bottom 10% has something they've never had before. So that leaves the middle 75%, the middle 75% of America who was happy with their doctor, happy with their private plan. I think that these people will suffer the most over the next 10 years before Obamacare collapses under its own weight. What do you see happening in the next 10 years?
Andy, I think you're right. And I think what's going to happen is you're going to see these large organizations called accountable care organizations, ACOs, which are sort of people are trying to set up now in response to Obamacare. And you're absolutely right. And let me tell you, we hadn't had time today to get into the Independent Payment Advisory Board and Medicare, but I've got a bill out to repeal that. That thing scares me to death for our senior citizens, is because absolutely rationing is going to happen. And what's going to happen is this, is that when people have a commodity like healthcare that they value like I do for my family, if I go and I can't get into my doctor, there are going to be doctors that are entrepreneurs that go out and open, they're already doing it, that have so-called a concierge medicine where you pay the doctor to see you whenever you need to. You're going to go see them. And you're going to have insurance to cover you if you go in the hospital. That's what's going to happen. It's happening right now. As a matter of fact, I plead guilty to already doing it here in Washington, D.C., so that I can be seen when I need to. Mm-hmm. So I have already done that myself. The doctor has done that. So it's going to happen, and you've got a guy like Jay Rockefeller, a multimillionaire, who supports the Independent Payment Advisory Board, which is going to ultimately end up rationing care for many senior citizens. And if you don't think it's going to happen, look at what's going on in England right now, where they're trying to use Skype for you to see your primary care doctor.
Mm-hmm.
Skype.
And Congressman, I think that's the answer, is what you hit on, is that the cost savings, the way that, because they're not going to be able to afford this program, so they're going to ration care. So people are going to be waiting. And if you're lucky enough to wait 14 months for a surgery, yeah, it's going to be cheaper. It's going to be a better deal. But if you die waiting, that's going to be the real problem. So it's almost like Russian roulette. If you can survive, yeah, maybe Obamacare is going to be good for you, but if you can't take these long waits like you see in Europe or you see in Canada, it's going to be bad news, and that's the real loss. It's the waiting. It's going to be the deaths of people waiting for care.
Andy, let me give you an example. I in my practice, just doing routine physical examinations in OBGYN office as I quit counting at 15 undiagnosed cancers of the thyroid. Mm-hmm. That wouldn't have, without a physical exam. I can't tell you how many breast cancers I picked up over the years on routine physicals. People, time for them to come in and get their physical. If you delay that, where they cannot get in to see you, whether it's decreased productivity with your EMR, whether it's just blatant rationing of care because you're only going to see so many. And by the way, you pointed out a great point here a minute ago, and I just thought about it when you said it. In the last 5 years in our office, in my practice, 120 years experience has walked out the front door and retired. They would have kept working. Mm-hmm. But they just got tired of all this stuff. They didn't need to. And a third of our physicians and nurses in this country are over 55 years of age.
Right. And Congressman, all the younger people who have to spend hundreds of thousands of dollars, either of their own money or they go into debt to go into medical school, Why? I mean, of course, it's a wonderful field, but financially, to take all of that risk, schooling for 10 years, many doctors in their early 30s when they can finally start practicing, and then you're all of a sudden walking into a system where there are price caps and price controls, and you can never make back in your investment. To me, it's not a good incentive to encourage young people to go into the field, and you've got older people in medicine who are saying, you know what, all the regulation, all the burden of Obamacare, plus I'm going to make less money. Why am I going to deal with it? So they're going to make one of two decisions. Turn into all cash and just treat wealthy people, or two, just get out of the business because it's too burdensome. So,
well, it is. It's a great way to make a living. I have to tell you, for young people, I talk to a lot of medical students, and we have a medical school in my hometown, and I speak to them not infrequently. And it's a terrific way to help people. That's the thing that you hope the government doesn't do, is mess up something that's the best healthcare system. We have problems, no doubt about it, but they're fixable. But I don't believe this is the solution.
Right. Well, Congressman, look, we got to jump, but it's an honor. Once again, Dr. Phil Roe, Congressman from the 1st District, reelected with 80%. So congratulations on that. And, Congressman, thank you for your time today.
Thanks, Andy. Thanks for having me on.
Okay, you take care.